Hello everyone, I am Alau Christian Gray, a Senior Associate in Hill Dickinson's Health Litigation team in London, where my work for many years has covered claims and complaints relating to cosmetic and aesthetic treatments for clinics, practitioners and insurers. Today, I'm going to be looking at the new regulations relating to cosmetic and non-surgical procedures. So what will we cover? Well, firstly, the current position and what brought us here. Then an overview of expected changes. And lastly, I just wanted to say a word or two about consent. So what is the current position and what brought us here? All of you will have heard of the PIP scandal, where it came to light that a French breast implant manufacturer had been illegally selling breast implants made from cheaper grade silicone rather than the mandated medical grade silicone they had previously used. Hundreds of thousands of unapproved implants sold globally by PIP from 2001 to 2010 were found to be at risk of rupturing, leaking, as well as being implicated in several deaths due to systemic toxicity. As a result of the PIP scandal, in 2013, Sir Bruce Keogh led a review into the regulation of surgical and non-surgical intervention. His review concluded that, and I think it's worth quoting in full, non-surgical interventions, which can have a major and irreversible adverse impact on health and well-being, are almost entirely unregulated. In fact, a person having a non-surgical cosmetic intervention has no more protection and redress than someone buying a ballpoint pen or a toothbrush. So pretty damning stuff. If we can jump ahead a little now in our timeline to 2021 and 2022, two significant pieces of legislation came into force. The first is a ban on the administration of Botox and other substances for cosmetic purposes to under 18s in England and Wales. The second is a paragraph in the Health and Care Act that gives the Secretary of State the power to introduce a licensing regime for non-surgical cosmetic procedures, such as Botox and fillers. The latter has been described as the biggest shake-up in the aesthetics sector, and that will be our focus today. Now, in July last year, we had a report published by the Health and Social Care Committee titled "The Impact of Body Image on Mental and Physical Health." The committee found that little had changed since Sir Keogh's review, and they quoted the Joint Council for Cosmetic Practitioners, that's the JCCP's research, which stated that of those seeking non-surgical procedures, and I've put a few datas up on the screen there that I think is worth reading out, 22% did not have any pre-treatment consultation, 70% had a consultation that lasted less than 20 minutes, almost 1 in 4 were not asked anything about their previous medical history during that consultation, and almost 4 out of 5, so almost all patients, were not asked anything at all about body image or psychological and emotional changes and challenges. So what's the latest? The committee's report sets out a number of recommendations to the government and urges priority action to define the scope and the proposed licensing. The government's response to the committee's report was published in February this year. It confirmed that it intends to introduce a licensing scheme, and at that time said it planned to communicate a plan for delivery by July this year. Now that didn't happen, but on the 14th of July, the government confirmed it would be publishing a public consultation on the scope of the treatments to be included in the licensing scheme some point later this summer. Now, up until this weekend, that was the latest I had for you, and my advice was going to be somewhat more speculative. However, on Saturday, the 2nd of September this year, the government published its consultation, which I have linked. The consultation is the first of two and is a very important part of the planning phase for the new licensing scheme, as it allows practitioners and the public to express their opinions and offer feedback on the proposals. The government will review the feedback provided and make amendments to the regulations accordingly, so your input is going to be really important here and could really shape the future of the regulations. So I really would urge you to go and have a look and provide any feedback you can. It is open for comment until the end of October this year. Once that feedback has been implemented, the regulations will then be debated and approved by both Houses of Parliament before becoming law. JCCP have also drafted a very helpful guide on how we should use that consultation. And again, if you're a practitioner, I would urge you to go and have a look at that, because it just talks through how we can respond to that consultation in a very user-friendly way. The scope of the first consultation is to gather feedback on 3 points, which I've listed there. The first is the types of treatment to be included in the licensing scheme. The second is considering whether any procedures should only be carried out by regulated healthcare professionals or under their clinical oversight. I'll look at both of these slides in the coming slides. And finally, looking at age restrictions on who may receive procedures. Essentially, we can cover this pretty quickly. It proposes mirroring the Botox and Cosmetic Fillers Children Act 2021, which prohibits practitioners from performing any procedures included within the scheme on people under the age of 18, unless that's been approved by a GMC registered doctor and is carried out by a specified healthcare professional. Now let's look at an overview of the expected changes. We know the regulations will prohibit an individual in England, and I will pause there just to emphasise that this only applies in England at the moment, from carrying out specified cosmetic procedures unless that person has a personal licence. To be clear here, this will not just apply to healthcare regulated professionals, for example, doctors and nurses. Clinically trained and non-healthcare trained professionals can continue to offer treatments, providing all practitioners have now been trained to an agreed national standard. It is likely that there will be a minimum standard of training, education and skill that all practitioners must now evidence they meet. Secondly, the regulations will prohibit an individual from using premises in England unless that person has a premises licence. Those premises will meet a national standard in health protection and infection control, a standard that we expect will be determined by local authority environmental health officers. Other standards are also expected to be included in the licence around things like product supply, how they are stored, complaints procedures, and how we prescribe in practice. So, let's look at what exactly is a cosmetic procedure for the purposes of these regulations. Now, that's been defined for some time, and the scope of cosmetic procedure was in the Health and Care Act 2022 at section 180, subsection 2. It will include those categories I've listed on the slide, for example, injecting a substance or inserting needles into the skin. We know it won't cover surgical or dental procedures. However, the government's consultation this weekend now sets out further detail and introduces a 3-tier system. The first of those is green. That is, procedures with the lowest risk of complications. Things like microneedling, IPL and LED therapies. Certain chemical peels are involved and certain types of hair removal. The green category will require all practitioners to meet the skills standards set out within the practitioner licence. The second category is amber. They're the procedures deemed to have a medium risk of complication, and there's a long list of those included in the consultation, but they include things like Botox injections, semi-permanent dermal fillers only if they're injected into the face, vitamin injections, spider vein treatment, weight loss injection, and medium depth peels. Now, for the amber category, like the green, practitioners will be required to meet the standard in the new licence, but it will require non-healthcare practitioners to be overseen by a nominated, regulated healthcare professional. Importantly, any procedure that requires a prescription-only medicine must be overseen by a healthcare professional who is a prescriber. It's worth also remembering here that we know the committee has recommended that dermal fillers become prescription-only substances. Now, finally, we can look at the third category, and that's red, those deemed to have the highest risk of all. Again, there's a long list in the consultation, but it includes things like thread lifting procedures, lasers if it targets those deeper layers of the dermis, any procedure aimed at augmenting the body, for example, breast or buttocks using dermal fillers or fat, chemical peels that are deemed to go deeper, and hay fever injections. Now, for the red category, they can only be carried out by licensed and regulated healthcare professionals working out of CQC registered premises. The government now considers that certain non-surgical cosmetic procedures are considered surgical or near surgical, are sufficiently invasive and will need to be overseen by the CQC. For example, as I listed above, dermal fillers if they're in the breast or the buttocks to augment a body. It also considers it necessary to amend the CQC's regulation to add certain cosmetic procedures to its list of regulated activities. This would render those procedures outside the scope of the new licensing scheme, as they are simply deemed too risky. Essentially, the government is considering whether some procedures should only be carried out by healthcare professionals or under their clinical oversight. So this traffic light three-tier system is very much the new detail that was shared this weekend, and anyone with an interest in it are asked to go and provide feedback on whether they agree with the proposal. So I would really urge you to go and have a look and give your feedback on whether you agree or disagree, because this is all going to be taken into account. So the new licensing scheme, what do we know? One of the key recommendations in the committee's report relates to education and training for practitioners. There's currently a total absence of mandatory education and training standards for those administering non-surgical cosmetic procedures, which can lead to a wide variety in the quality of intervention, resulting in potential patient safety issues. Now, quite often as a lawyer, that's where I'm brought in, where things have unfortunately gone wrong. Essentially, as it stands, anybody can administer a non-surgical cosmetic procedure. The committee has asked for a minimum standard for training for all practitioners and asked that this be a central pillar of the licensing regime, which is a welcome move by everybody. We hope to see a nationally determined standard of skill and proficiency required by all practitioners in England, irrespective of background. Individuals will now have to prove their capability. What that standard is, we don't yet know, but it will be determined after a period of consultation and discussion with practitioners. The government are going to want practitioners' feedback on this to help define it. So again, I would really urge you to get involved when that stage of consultation is out. Let's look next at something that will be of interest to you, I'm sure, and that's enforcement. Will someone be banned, essentially, from offering procedures if they can't demonstrate that they have the correct qualifications or training? Well, it certainly seems that that's the intention. The regulations will prohibit people from carrying out a procedure or using premises without relevant licensing. What we expect to see here, and what I think would be really helpful, is a national list or a register where everybody can go on, look up that practitioner, check if they're registered, and find out exactly what they're registered to do. A sort of central hub, if you like, and it will be important that there's enough information around that the public know it exists and that it's very user-friendly. This will be a very important step towards transparency, because previously it's been so hard to know what or who is reputable and to do what, especially with what we see on social media around cosmetic treatments. If someone did operate without a licence, this would be an offence for which there would be a penalty. We expect that penalty to be monetary in nature. We don't yet know the amount, but reason would suggest it has to be high enough to be a deterrent for someone trying to practice without a licence, in order to be fair to those who have gone and invested time and money into obtaining a licence. Now, what about premises and inspection? The Act says it may not grant licence without an inspection, so it is likely that there will be an inspection as an element to the regulations. But when I've looked at other areas of licensing, they sometimes take place, as far as I can see, during the course of the licence, i.e. if it is a 3 to 5 year licence, during those 3 to 5 years, rather than all needing to happen beforehand. Finally, insurance. The level of insurance is yet to be decided, but it certainly will be mandatory for procedures covered under the scheme of the licence, which is seen as an important step to protect the public. Now, finally, I just wanted to mention consent as although it's not the focus of this first consultation, the committee have made some interesting recommendations, and it gives us an idea of what to expect, as it sets the bar, I think, really quite high. As I've listed on the slide there, it introduces a two-part process of consent. That involves at a minimum, a full medical and mental health history, and then a 48-hour cooling off period between consent and the consenting process and that individual undergoing the procedure. So quite a big change. I wanted to consider the recommendations for a full mental health history. Professor David Sines of the JCCP has said that there should be no assessment without a psychological and emotional assessment, which he does acknowledge would require the training standard to include training in psychological screening. Now, we don't have time today to deep dive into the law of consent. That is something that Hill Dickinson offer lots of training on as a separate topic, but I do think it's worth considering this particular element of the requirement. It echoes what we've seen already when the GMC issued guidance in 2016 specifically for those working in the cosmetic industry. At that time, it imposed arguably a higher standard than in any other medical industry, and that is, I think, done to address the issues of reputation in this area. Now, I wanted to highlight a few points in that guidance, as I think they might be a helpful indicator of what we might expect to see come out in the new regulations. We know it applies to all doctors who carry out both surgical and non-surgical procedures, including things like dermal fillers. However, even then in 2016, it made clear that it is a useful framework for other professionals, including beauticians and nurses. So arguably, it's a standard that others should be striving to meet, or in any event, certainly since 2016. Again, in those guidelines, we see this requirement to consider the psychological need of patients. The GMC specifically requires patients to be asked why they want the intervention and what outcome they hope for. If the practitioner does not believe the intervention would benefit the patient or deliver the desired outcome, it should simply not be provided. Paragraph 19 of the GMC's guidance requires a specific discussion around a patient's vulnerabilities and psychological needs. It also requires practitioners to consider referring a patient to a colleague if there's a health condition that falls outside their expertise. For example, they should consider referring them for a psychological assessment first, which may come as a surprise to some. And I've always thought this was quite a tricky balance, because the realities are, certainly of those practitioners I've talked with, most patients that they see have some element perhaps of self-confidence or some issues of self-doubt that lead to them wanting that particular intervention. So recognising where perhaps low self-esteem might become a recognised psychological disorder is something that all practitioners would be expected to identify. So I think it's fair to say that would certainly need to form part of the training, to train practitioners in, as Sir David Sines says, that psychological screening beforehand. Finally, I just thought it was worth mentioning that the GMC in 2016 also required what it describes as a time for reflection. Unlike the committee's report, which has suggested 48 hours, it does not state a time frame. Instead, it states the amount of time that patients need for reflection will depend on things like the invasiveness and the permanence of that particular procedure. So it leaves a degree of subjectivity and discretion for the practitioners. Depending what feedback the government receive, it could be that this is what we ultimately see in the new regulations. So let's look at what's next. What we do know for sure is that the government is committed to introducing a licence for non-cosmetic interventions. It has now, as of this weekend, published the first of 2 national public consultation exercises. I've said it before, but I will say it again, we would really urge you to go and take part in both, because this really will help shape the future of the regulations. It's very easy to do. You go online on the government website, we've linked the exact link you need, and answer the questions and give feedback where prompted to. That first consultation is live, and it will be live until the end of October. What the government has proposed then is that it will publish the details of those responses received and their finalised position in 2024 and 2025. They will then work with expert groups on the elements that will underpin the licensing scheme, including, as we've discussed, education and training standard, insurance and fees. These regulations will then be the subject of legislative scrutiny and ultimately will become law, expected in, say, 2 to 3 years' time. One point of reassurance that I think it's worth mentioning here is that the government has advised that there will be a set lead-in time, or a transitionary period, before the scheme is in full operation across England, a grace period, if you will. So, even when it does exist, practitioners aren't going to be expected overnight to have everything sorted, so there's really no need to panic here. But, although no need to panic, changes are coming. They are going to be significant, but it's important to say that most, that's both patients and practitioners, view this as a positive. It's really about protecting both the public and, of course, practitioners to ensure a uniform standard and ultimately to give this industry the professional reputation it deserves. Thank you.